Hello everyone, in this section of the video we will talk about breastfeeding complications. Not something nice to hear, but yes, sometimes when we are breastfeeding and so-called our technique is not right, we ended up having some complications. The three most common one I will share with you here, which is sore nipples and engorgement, and lastly mastitis. Sore nipples. It happens when your baby's latch is not correct. That means your baby is probably only sucking on the tip of your nipple and not getting the areola and the nipple together. Your baby's sucks are not right, and that's where you ended up having a sore or cracked nipple. It can even lead to bleeding. It's very awful, and mostly mothers get so paranoid they ended up, not continue with the breastfeeding. First and foremost, you need to know that this can be prevented. How you can do it? By having a correct latch. If you are not sure about the correct latch, and you always, whenever you breastfeed, after that you feel a tingling sensation, you feel a redness is coming up on your breast, seek help early. There are these breastfeeding specialists available in all our local hospitals. They are technically known as lactation consultants. They will be able to help you how to correct your latch. Now, if you already have a sore nipple, you can still continue to breastfeed. What you can do is, of course, you can rest that side of the breast first, which is sore. You can latch on the other side. Because when the first time baby is sucking onto your breast, the sucks are quite rigorous and also vigorous. With the first few sucks, the strong sucks baby is having, you may feel more uncomfortable. Secondly, you can put your own breast milk on your breast and air dry it. Try not to wear bra for a while. Air dry your breast so that you can relieve your sore nipples. And there are some creams, petroleum jelly kind of creams available in the market. What you need to do is, don't just see this video and start doing these remedies. If you feel that you're having a sore nipple, please make an appointment with your doctor, who will refer you to the lactation consultant or breastfeeding specialist. Second commonly condition mothers feel is engorgement. It's a very kind of a technical term, but what does it mean? Simply that your breast milk is entrapped inside your breast. Because it's full of that breast milk, it feel heavy, as well as you have a feeling when you touch like you are having a rock on your body. And it is very, very hard, not only for you to bear with this engorged breast, also for your little baby. Because when the breasts are so hard and so-called engorged, very hard for your babies to latch and empty those breasts. What is the common way you can relieve your engorgement? By relieving that breast milk. That means taking out of the breast milk. Who will do that? Baby. But baby can't suck well because the breasts are so hard. They are not used to that hard breast. So how? It's a vicious cycle. So nothing is coming out and breast becoming more and more engorged. And when the milk trapped for very, very long, ended up having an infection called mastitis. Mastitis, some of the signs are redness, you may even have a pus, and you even may ended up having a high fever. You may not even able to feed your baby, and many of the times mothers have to end up with a small surgery or incision to take out that pus. So how can you avoid reaching to the mastitis, or rather before that engorgement state? First and foremost, feed your baby regularly. Make sure your baby is emptying your breast well. However, there are times that you feel that your baby is not able to empty your breast well. It's okay. You can do a manual massage and can extract out the milk and store that milk. Or you can use and invest some simple things like breastfeeding pumps. There are many available in the market. You can use an electronic one, you can use a manual one, and again, if you can't invest in any, use this pump, your hands. You can still able to extract out the milk. And this is also very important, when you have some stored breast milk, daddies can bond with the baby. When you are tired, or rather you want to have some rest, you can ask daddies to be engaged in so-called breastfeeding via bottle feed. However, still sometimes we ended up having engorgement. What to do then? Again, simple thing, you can, of course, use massage, or you can use hot and cold compress. You can use the warm and the ice cold water, the so-called the towels you can use to alternate to relieve that engorgement for a time being. But again, having said and done, it's not easy to manage all these things alone. A simple and a very talented person who can help you locally to deal with all these breastfeeding problems are the lactation consultants. These angels are available everywhere throughout the island in our hospitals. Please go and make an appointment with your doctor, who can refer you to the lactation consultant. According to World Health Organization, first 6 months of baby's life are very important, and they need all the important nutrients which are present in breast milk. As a mother, the best thing, the best gift we can do to our baby or give to our baby is by feeding them the breast milk. Of course, there are some complications which comes along the way. but there are remedies available. Always remember, you are not alone. All you need to know is, where there is a will, there is a way. Keep going and enjoy your breastfeeding. Thank you.